Hi, everyone. It's Dr. Sheftal again with Truth in Science. We have an interesting video tonight, hopefully. It's part one of a two-part series that I'm doing about the vaccine. And it involves the mathematics of it, but it's limited to arithmetic. And some of the results I found when I ran the numbers from the trials through these statistical parameters, calculated the value of the parameters, might surprise you in what they imply. And so let's get started. This is the bona fides page, which I always put on, but we'll skip it again. This is a slide from the presentation I did last time, which is about a week ago, I think now. And it showed that the vaccines had nothing to do with the drop in cases that we have fortunately experienced recently since January 8th. And the reason they didn't have anything to do with it, the proof that they didn't have anything to do with it, is that by the time at the time that the cases started to turn and drop off a cliff and go down very rapidly, only about 0.1% of the population had been vaccinated and had enough time to mount an antibody response. The vaccination started on December 14th, and the time it takes to mount a full antibody response is about 3 weeks. So that gets you to January 7th. So there's about 1 day's worth of fully realized antibody presence in the population, which amounted to 0.1% roughly. Okay. When you go to make a decision on whether to have a vaccine, and let me say from the outset that this presentation is not a call to have the vaccine or not have the vaccine for anyone, especially a doctor, to tell people to have something or not have something. Requires that he knows the patient intimately, that he knows, frankly, more about the vaccine than I know, and many, many other things. So I'm not trying to tell people to take the vaccine or not. I feel like my role here is just I got a hold of some of the data on the vaccine trials, and I wanted to explain mathematically what the values of important parameters are and what they imply. And we could sort of, even though we can't discuss it, I can kind of anticipate your questions and discuss it with you in a way. So when you go to make a decision on a vaccine, you want to know what the risks and the benefits are, of course. And you also need to know the chance that they will work, because even if there's a great benefit, if it only works in 1% of the people, then it may not be that valuable. So what do we mean by work anyway? For a vaccine to work, traditionally, it meant that that vaccine prevented you from getting the disease if you encounter the pathogen in the future, right? We already know that the messenger RNA vaccines that have been in the news lately and that a lot of people have gotten do not prevent you from getting or spreading the disease. And believe it or not, a lot of people still do not realize that. They assumed it was a vaccine, and they were told that there was a 95% efficacy, so they thought it prevented 95% of the recipients, for example, from getting the disease and spreading it. That is not the case, as many people know by now. All right, so if they don't help you prevent you from getting the disease, and they don't prevent you from spreading the disease, do they do anything helpful? That's the question we're going to talk about tonight. And in that regard, what exactly does the 95% efficacy that Dr. Fauci has talked about and others, what does that actually mean? Well, I'm going to explain all of it to you tonight. First, we're going to go over 3 definitions of parameters that will help us be able to make sense out of the raw numbers, if you will. And the first one we're going to look at is absolute risk reduction. It is the percent of bad outcomes in the control group minus the percent of bad outcomes in the treated group when testing a treatment, okay? Now, suppose you have a randomized controlled trial of a treatment for some disease, okay? And by the way to understand these parameters, these definitions, is just to do a few examples and it'll be real clear. But you've got a randomized controlled trial here. 40% of those treated had a bad outcome versus 60% in the control group who had a bad outcome. So the ARR would be 60% minus 40% equals 20%. Okay? So what does that mean in everyday, ordinary English conversation? 20% of what? Well, let's get a little bit more detailed on our example and it'll become very clear what conclusions you can draw from that. So suppose that there's this disease out there that causes blindness, and a very smart scientist has synthesized a molecule that he thinks will reduce the chance of blindness, the incidence of blindness in the people who get that disease. So they want to test it scientifically, and they take 100 people in the control group. Those are the people that will not have the treatment, and 100 people in the treated group. And they must also set that term I use, bad outcome, to something. And it's fairly obvious in that case, they would probably set the bad outcome at blindness, okay? So in the example we just gave, applying the numbers here, we'd have 60 people who became blind in the control group. Those are the people that did not get the treatment, and 40 in the treated group, okay? So again, the ARR is going to be percent of bad outcomes or percent of blindness in the control group minus the percent of blindness in the treated group. So the ARR would be 20%. Okay, now, so what that means is that you could conclude from that for every 100 patients you treat in the general population, 20 of those 100 will avoid becoming blind. Okay, that's what that trial shows you. All right. The relative risk is the proportion of bad outcomes in the treated group divided by the proportion of bad outcomes in the control group. And we sure do hope that number is less than 1, because if it was greater than 1, it would imply that the treatments had made things worse, okay? So in the example we gave, it would be 40% divided by 60% equals 0.67 for the relative risk. By the way, if it's very hard to understand things like that the first time anybody hears them. So if you don't quite understand the ARR and the RR and the triple R and the things I'm going to show you, you can go back and look at it and go over it, because when we plug in the numbers from COVID, you're going to get some results that might surprise you. And that's why that was the reason I made the video. All right. The relative risk reduction is the percent reduction in bad outcomes compared to the control group. Okay. So in the example we keep using, 60% of the people in the control group got blind, but that got reduced down to 40% in the treated group, if you will. So the percent reduction is 60 minus 40. That was the reduction divided by 60. So that would be the percent of 60 that was reduced. And that's 0.33, 1/3. So 20 over 60 is 1/3. And that would be the relative risk reduction in the example we gave. And just because of a little mathematical thing that I happen to know about, the relative risk reduction would always also be 1 minus the relative risk. All right. So let's now look at what we came here to learn about, and that's the Moderna and Pfizer messenger RNA vaccines. First, they had to choose what the bad outcome would be. You know, would it be death? Would it be hospitalization? Would it be need for the ICU? Well, they did not choose those as the bad outcome. Their bad outcome was, well, let me just read it to you, or part of it, and sort of explain where they're coming from here. The endpoint, the primary efficacy endpoint, is really what the bad outcome is, because if someone reaches the endpoint, they go in the group that experienced the bad outcome. Sorry for being a little tongue-tied there, but I think you'll understand this when we get through it. At least, let me just read it. At least two of the following symptoms. A patient that experiences at least two of the following symptoms: fever, chills, myalgia, headache, sore throat, etc., typical symptoms, or at least one of the following respiratory symptoms, such as radiological evidence of, such as cough, shortness of breath, difficulty breathing, or finally, radiological evidence of pneumonia, etc., in combination with a positive PCR test. But the point I'm trying to make is their bad outcome is two or more of the following symptoms, or at least one respiratory symptom, etc. Okay? And then Pfizer very similarly listed a bunch of symptoms. They said the presence of at least one of the following symptoms and a positive PCR test, of course: fever, new or increased cough, new shortness of breath, chills, etc. Okay, loss of taste or smell. So what the trials were designed to measure did not have anything to do with preventing, well, let me say it this way. The bad outcome that was chosen was either one or two symptoms in different categories that the patient might experience. That's how they measured the efficacy of the vaccines, whether it could prevent some symptoms, basically, okay? Now, here's something that's really important about this. Again, this is one of these things that motivates me to do these videos and explain to people who might be watching TV primarily for their understanding of all this. As you can see from me reading the endpoints, they're all about numbers of symptoms, two from this category, one from this category, etc. They do not in any way measure the vaccine's ability to prevent a recipient from getting infected or prevent a recipient from spreading the disease, okay? And yet on television every day, I see the TV doctors and the bureaucratic doctors tell the public that we need to get everyone vaccinated so we can get to herd immunity. But the vaccine trials did not measure the ability of the vaccine to block someone from getting the disease or block them from transmitting it, which is what is involved in reaching herd immunity. You know, you want the people in the population to not be able to transmit it to the next person, but that wasn't involved at all in the vaccine trials. So it's beyond me why they keep saying something like that. Basically, that has nothing to do with what the vaccines were tested for. Okay, and we know, like I said earlier, that they do not prevent people from getting the disease or transmitting it. So I'm not really sure why the doctors keep saying this. Okay, is all it really does is the only thing that's been measured is their ability to reduce symptom number. Okay, let's go over the raw data from the Pfizer trials, and I'll apply it to the formulas for the parameters that I mentioned before. We'll talk about the implications. So in the Pfizer trials, we'll take first, and then I'll just read you the results from the Moderna trial, so we don't have to do it twice. But in the Pfizer trials, you had over 18,000 participants in both the control group and the vaccinated group, a lot of people there, and only 8 patients in the vaccinated group reached the primary efficacy endpoint, which is the bad outcome. Remember, we talked about that. You used that term before. That reached that endpoint, which we'll call PEE from now on. Only 8 patients in the vaccinated group. That looks pretty good, right? 162 reached it in the control group. That's the group that didn't get the vaccine, okay? So maybe it looks pretty good right there, but hang on, hold on to your hat for a second. All right, so let's plug it in. Remember, the absolute risk reduction is the percent of people reaching the PEE in the control group minus the percent reaching it in the vaccinated group. And we know that in the control group, 162 people reached it out of 18,000 plus in that group for a percent of 0.884. And in the vaccinated group, only 8 people reached it out of their very large 18,000 plus group, okay? for a percent of 0.044. And when you subtract these two, as per the definition of the absolute risk reduction, you get 0.84%. Now, just a quick implication from this. The absolute risk reduction of getting the vaccine is less than 1%, okay? Just think about that for a second. Only less than 1% in risk reduction from getting that vaccine? Okay, let's move on and I'll show you how important these implications are in just a second. All right, the relative risk is the number of participants who reach the endpoint in the vaccinated group divided by the number in the control group. And we've already calculated this. This is the number that reached it in the, or the percent that, or the decimal that reached it in the vaccinated group. And you've got to divide that by the group, the number that reached it in the control group. And when you do that, you get 5%, okay? So the relative risk is 5%. The relative risk reduction is the percent reduction in reaching the endpoint compared to the controls, okay? And I mentioned earlier that that's 1 minus the relative risk. And so that's 95% it comes out to be. 1 minus 5% is 95%. And that's what you're seeing on television about the vaccines being referred to as having a 95% efficacy, okay? Which sounds really good, doesn't it? I mean, you can imagine someone in the general public that is not, does not have this kind of background, possibly saying something like, wow, the vaccines are amazing. They have an efficacy of 95%, okay? Well, what does it all mean? It's going to surprise you quite possibly. It's not what you think. I have taken the liberty of listing the values that I just calculated with the raw numbers up here, the ARR, RR, and RRR. And I want to tell you sort of in everyday, ordinary English conversation what this means so that you can think about something that may be more understandable instead of just a bunch of decimal numbers. Okay, we have established that the absolute risk reduction is 0.84%. What that means, that's less than 1% now. That means you have to give the vaccine to 119 people, 2 doses, that's 238 jabs, if you will, before you prevent just 1 person from benefiting, okay? And the way I arrived at the 119, of course, is I divided 100 by 0.84. It's less than 1, so this number's got to be greater than 100, okay? Think about this for a second. If you want to look at this another way, it means that someone who went through those 2 injections has an over 99% chance that they will not work, okay? Think about that. Because you need to go to more than 100 people before you find someone that it works on, right? Because it's a less than 1% risk reduction, okay? Think about that for a second. Let it just sort of go in, go over it again if you have to. Because at first you go, what? What is that? Think of it this way. Let's see. If the chance was 1%, not 0.84%, if there was a 1% risk reduction, and you check 1 person, it's not likely that they got a risk reduction because the chance is only 1% that it would have happened. You know, you got to go all the way up to 100 people before somebody gets a risk reduction. In other words, a benefit from the vaccine, okay? But since it's less than 1%, you've got to go beyond 100 people before somebody gets it. All right. Now, given the side effects and the potential problems associated with these vaccines, and we're just learning and studying them now, there's potential for autoimmunity from these, and I'll tell you why later. There's horrible side effects from some of them, and they occur in great frequency. In some cases, 80% of the participants got side effects from the second vaccine and so forth. 17% of which were very severe side effects. And we also know that patients have died from the vaccine. We don't know how many. It's very hard to find. I looked very hard for it, and I could not find the total up-to-date number. But the TV and bureaucratic doctors are pushing everyone, again, to get a vaccine that does not reduce transmissibility or infection and requires more than 100 people, 119 people to get 2 jabs each before one person reduces his symptoms by one number, by one symptom, because that is the endpoint. Think about it. If the endpoint, say, is 2 symptoms from this category and a positive PCR test, the way to drop them down into the other group that did not benefit from the vaccine would be to reduce those 2 symptoms down to 1. So you're talking about one person out of 119 getting the benefit of one symptom less than he had before as the benefit of the price you pay to make 119 people get a vaccine with all the side effects and horrible possible potential problems associated with it, which we'll get to. By the way, I will go into those in detail in the next video. This one is only about the mathematical implications of all the numbers. I'm going to make a separate video for the other part, for the possible problems we can have from these vaccines. All right. Now, let's look at the relative risk of 5% and the relative risk reduction of 95% and see what that implies. Well, you might think you're reducing something really bad by 95%. That's got to be great, doesn't it? It's really good. Well, not necessarily, because if the chance of getting to that endpoint is very, very low in the first place, and we know that only 162 out of 18,325 people did so in the untreated group, and it's reduced by 95%, it's not going to mean that much. Let me give you an example. Suppose I was a goofy high school student, not too hard to imagine. But I loved this beautiful girl in high school and I wanted to have a date with her. And let's say my chance was 1 in 1,000 of getting a date with her. And let's also put in the story that I used to wear white socks with loafers to school every day. So one of my friends comes up to me and he says, "Hey, Reed, you can increase your chances by 95% of getting a date with her if you stop wearing white socks with your loafers and wear dark blue socks." Okay, and that could certainly be true, but it's not going to help my chances of getting a date with her very much in reality, because my chance is only 1 in 1,000 anyway. So I knock it up 95%, and now it's just under 2 in 1,000. See? So when the chance of something happening is really, really, really small, having a relative risk reduction of 95% means almost nothing. It's not very valuable, okay? Now, this is the number you've heard that number before, haven't you? 95%. We hear it on TV every day. The vaccines have 95% efficacy. But the problem is there are so few people in the population that are getting to that level of having a number of symptoms, serious symptoms, that it doesn't mean that much, okay? It's used almost, I hate to say it, as an advertisement to say the vaccine's better than it is. Hope I didn't go too far over the line there. But it doesn't tell the whole story, not by any stretch. It's way overstating the value of the vaccines, let's put it that way. Now, I won't go over the quotients and the calculations for the parameters in the Moderna trials, but they are very similar to what we got in the Pfizer trials. The absolute risk reduction was 1.25%, a little over 1% this time. It was 0.84% in the Pfizer trial. Relative risk was 6% this time. It was 5% in the Pfizer trial. And the triple R was 94% with the Moderna vaccine and 95% with the Pfizer. So they're very similar. what I said in detail about the implications of the Pfizer number certainly applies to the Moderna numbers. Now, there are a lot of problems. There's sort of three categories of problems with the trials, and I'll mention a few of them now. And then, but in the next video, I'm going to explain as many problems as I can find in the literature that people have surmised and it certainly warrant deep study to find out if these vaccines are going to have problems with autoimmunity, because the spike protein that's translated from the messenger RNA has some morphological similarity with some proteins in the body, meaning it's got a similar shape. And when you make antibodies to something, to a protein, and it's a similar shape of another protein in the body, there's a chance that you could kind of get cross-reactivity with that antibody towards the protein that's in the body. And that's what autoimmunity is, when you start attacking your own cells and proteins. So we've discovered already that the placental syncytia, for example, has epitopes on it, which means shapes of pieces of the protein that the antibody will attack that are very similar to the spike protein on SARS-CoV-2, okay? So that's just one example of some of the things that we're concerned might happen in the future. If that's the case, then it's possible infertility could result. So that's one of the types of problems we have seen or we've worried about with the vaccine. And when I say we, I'm not talking about myself. I deserve no credit. I'm talking about the scientists that are studying this to find out if we're going to have a problem with it. The other thing is the other problem with the trials is that there's a difference in the rates of death among the general population and the people in the trials by a huge amount. The general population is dying at rates 30 times and 6.3 times higher than the vaccinated and placebo group in the trials from COVID. I mean, they're dying from COVID. So we're wondering, you know, were the participants in the trial much healthier so that they're surviving better than the general population, as if they were cherry picked in some way, which would be a problem, you know, because when you do trials, you really need to test a decent sampling of the population. We know pregnant women weren't tested, and we know that children weren't tested, which I'm learning could be a very good thing based on what I'm telling you tonight. So here's a quote, a statement, let's put it that way, that I put in quotes. Someone who takes this vaccine has an over 99% chance that it will not work. Now, that is a direct consequence of the absolute risk reduction being less than 1%. Okay, it's a mathematical guarantee, let's say. And so, but when you put it in words, it's kind of shocking, isn't it? So if you take a person who gets the vaccine in the trial and a person who's in the control group who didn't, there's a 99% chance after one of them gets 2 shots of the vaccine that they'll both be in the same position. Think of it that way. The guy that got the 2 shots did not get his risk reduced because the absolute risk reduction is only 0.84%, less than 1 in 100 people, okay? So that means there's greater than 99% chance that it didn't work, okay? And remember what working means, just to go over it one more time, because it's so important to the statements that are made on television and everything. Working just means reducing a symptom, the number of symptoms, by 1. Okay, that means the vaccine worked according to the endpoint that they chose. Remember, they had to choose a bad outcome, and that's what they chose. It wasn't death, it wasn't need for ICU or any of that. It was number of symptoms. And so if you just reduce it by one, that knocks you down into the other category. If you need two and you have two and you can eliminate one of them from the vaccine, that will knock you down. That would mean working, okay, in this case. Doesn't mean it keeps you from getting the disease or reduces transmission. So really, was it just a big waste of money? No, it was, or a gift to pharma, big pharma that's making the vaccines? No, it was worse than that, because a lot of those 119 people that we're talking about, they're going to get terrible some of them are going to get terrible side effects. And let me tell you, the side effect profiles for these things are frequent and severe, up to 80%, and some in one of them after the second dose. Like the Moderna one has a lot of side effects. Statistically, I believe it's over 80% of the participants get them. Some are severe. 17, I think, point something percent got severe side effects. But some recipients will also die from the vaccine. You know, we've seen recently, sadly, that great people like Hank Aaron died 2 weeks after his vaccine. The TV reporter that I saw the story presented by said that it had nothing to do with the vaccine, but it's like 2 weeks or so after the vaccine. And so you really would like to know the total number of people who have died, but I can't find the information on the internet. And I've already talked about the morphological similarity of the spike proteins with other tissues in the body and what that might imply. All this is going to be covered on part 2. And again, thanks a lot for watching. And you know, if you don't quite believe or see where I came up with the statements that I made, it's all in there. If you just sort of go back and make sure you know the definition of the parameters, think about the examples that were given, and then plug in the numbers for these trials, and those are the conclusions you will draw. So please, I'd appreciate it if you're interested and would like to see some of the other videos that I've made, and you can do that by going to YouTube and putting in my name, and then Truth in Science, Dr. Reach Updahl, Truth in Science, and take a look at a couple of them if you're interested. They're of all sorts of different topics. Most of them are about the virus and the vaccine. When things switch over to climate change, I'll put a bunch of them in about that, I'm sure. But I will put my Patreon link in the right below the video. And so if you could click and go over there and maybe become a patron, that would be a tremendous help. These videos take a long time to make, as much an amateur I am at presenting them. But thanks again for watching, and let me know if you're interested in any of these topics in here that I proposed I might do if people are interested. And thank you, and I'll see you down the road. Thank you.